The cosmetics, obviously, my teeth are, the veneers have restored my smile or made me have a very nice smile and given me a much better look cosmetically. But the second thing, and just as important, if not more so, is that I was having pain in my neck, in my jaw, and in my temples, more like headaches, if you will. And a lot of that was brought to my attention by Dr. Eckert, and through the process of realigning my bite so that it was more natural, it alleviated that, and that has been just as much of the experience as getting the cosmetics. So it's more of a pain-free existence. It's a better posture and a more comfortable way of even down to sitting and chewing and turning my head left and right. There's been positive results from that as my musculature has relaxed to the point where when I'm just walking around every day, I have a comfortable bite. But obviously, it's been very positive, and that's one of the reasons why I would like to do this video, because the video would have been very helpful for me if I could have seen what we're doing now a few years ago. It would have sped the process up and made me more comfortable. And the cosmetics are great. The muscular issues and bite alignment have all turned out very well, because it wasn't reactive, like you said. It was proactive. And I feel like, even though, you know, the veneers, the material that they use for your veneers is softer than your enamel that you have naturally. But you don't, in my case anyway, you don't need so much force, because now the functionality is the same, but the force is less, because I don't use all of my energy to grind my teeth, which then allows me to feel more comfortable, which allows me to orientate myself, if you will, with my posture and my neck and feel better. And when you realize all of that, it's like an epiphany. You know, I didn't know if we'd really get there when I first started. He said he thought I would, or that I would, but my expectations were here, and they were exceeded. So he's consistently calm. He explains things in a very straightforward way with which I like. You know, I like the detail. Some people may just say, fix it, I don't care, I trust you, the process. But I'm more of I would like to know what's going on ahead of time. He was pretty good at that. He's very good that way. And then his attention to detail was something I didn't expect. His previous dentists, like I said, I had been to, it was just much more of a traditional experience that everybody, in my age group anyway, grew up with. You know, dentists were not it wasn't a precise process necessarily. It was, let's get you back going, and then you can go on for another few years, and then we'll address whatever issue you have after that. You know, maybe one or two teeth at a time. And you just have to understand that I do, and I understand it, and I can advocate for it now, that he will do it to the best of his ability, and he'll do it right. He'll do it to your satisfaction. And he has, for me, he has.